All right. Well, I'm hoping we'll have some more people trickle in as the other session winds up, but I think we should get started since we have 6 talks and just 2 hours to get through them. I'm Susan Handy. I'm professor at the University of California at Davis, and I will be moderating this session, which mostly means just sort of keeping you all on time and introducing each of our speakers. Just a couple notes. We'll do questions through chat. Each speaker will have about 20 minutes, and that includes the question time. So hopefully you'll save a few minutes at the end. And we can see what questions have come in through chat. And if we're not such a big group, maybe we can open it up to live questions as well. So this is a session on transportation equity and community mobility. It looks like we are a little bit California heavy with 3 talks from UC Irvine, but we have a couple of talks also from the East Coast and one from the Netherlands, so suitably international. And a very interesting slate of topics. A couple of which are more sort of equity and mobility in a general sense, but several papers focused on specific populations and their specific needs. So really looking forward to this set of papers, and just very happy to have you all here at this really great conference. Okay, so we'll launch right in. Our first speaker is Mahbuba Chowdhury from UC Irvine. And our helper here is Mubarak, who's going to make sure that you all are able to share your screens. So, Mahbuba.
Thank you. Can I share my screen? Can you hear me?
Yeah, you can go ahead. Share your screen.
Okay, thank you. Can you all see the slide on full screen mode?
Yes, perfect.
Okay, thank you. I am Mahbuba Chowdhury. I am a PhD student of civil engineering at the Department of Civil and Environmental Engineering at UC Irvine. Today, I will be presenting my research titled Barriers and Facilitators to Rural Care-Related Mobility for California Caregivers. So this is the outline of my presentation. First, I will introduce the context and motivation behind the study. Then I will talk about the research question, methodology, results. And finally, I will conclude with key findings, policy implication, study limitation, etc. So first, I want to discuss why caregiver mobility in the Antelope Valley is important to us. So caregiver mobility is especially challenging in semi-rural areas. The challenges include sparse and unreliable transit, financial burdens, high time demands, limited social support. These type of barriers hinders both healthcare and social recreation related trips. The consequences includes missed health appointments, reduced family leisure, social isolation, and as a result, the well-being of caregivers and their care recipients is affected. But community-based organizations such as Johanna Centers provide mobility incentives to caregivers, although these type of solutions are temporary. And another problem is the evidence from rural areas for what type of care-related travel is important and what type of barriers are important to look at is very limited. That's where our research come in. So these are the primary research questions that we focused on. The first one is what are the significant determinants of mood choice for rural caregiver escort trips in California? And the second one is what are the significant determinants of foregoing rural caregiver escort trips? Now I will briefly talk about the methodology. So we conducted a stated preference survey among the California caregivers. First, we did a pilot survey to refine our questionnaire with only 88 participants. Then with our final refined questionnaire, we conducted a survey, and the survey was distributed via our community partners mailing list and prolific data collection platform. The target population for this survey was caregivers who live in California, at least 18 years old, fluent in English, and for the prolific sample earn less than $100,000 in annual household income. From both platforms, we collected a total of 349 valid responses. 45 of them came from Ohana Center mailing list, and 304 responses came from Prolific. So the final survey consisted of 5 main sections. So the core part of this survey was 2 sets of discrete choice experiments, which included 6 healthcare escort trip scenarios and 6 social recreational escort trip scenarios. And in the second part, we had 15 well-being related questions adopted from Brief Universal Prevention Program survey, and 11 transportation question related to transportation insecurity, and 10 question related to socio-demographic and household characteristics of the caregivers. In the discrete choice experiments, caregiver could pick from 3 mode alternatives: rental car, on-demand microtransit, and public transit, or they could opt out. And the discrete choice experiment included 12 stated preference scenarios, and each scenario included 6 modal attributes: travel cost, travel time, waiting time, walking time, cleaning frequency, and ADA accessibility. So many discrete choice experiment ignore cleaning frequency and ADA accessibility, but we decided to include those because these attributes could be important to caregivers who have care recipients with mobility impairments, or caregivers who have immunocompromised care recipients. Then from our collected data, we estimated an integrated choice and latent variable, or ICLB model, with a mixed legit choice component. We included randomized alternative specific constant and a travel cost because we wanted to measure the heterogeneity in baseline preferences and heterogeneity in travel cost sensitivity. Our model had 3 main components: measurement model, structural model, and choice model. So this is the choice generalized equation of our choice model. So we had 4 alternatives I already mentioned, and we had 2 alternative generic coefficient for waiting time and travel time. We had 3 alternative specific coefficient for walking time, cleaning frequency, ADA accessibility. And for the opt-out, in the opt-out alternative, we included coefficient for income, scenario characteristic, and also the latent variable. And we also included a shared error component for microtransit alternative and public transit, because we wanted to see if there is any shared heterogeneity exists among these two alternatives. The latent construct of our model, psychological well-being, is measured using 4 questions provided in the BAPS. So The individual specific latent variable is defined as the equation provided in the slide. Now I will briefly talk about the results. So these are the sample distribution for socio-demographic and household characteristics. So I don't have time to go through every category, but I want to mention two findings from here that will be relevant from for the results that I will discuss later. So we can see that 39.8% care recipients have mobility impairments, and also 10.3% caregivers have under 15K annual income. This is the second part of the table. So here we can see that over 50% caregivers in our sample had only one private vehicle or no private vehicle in their household. So this figure summarizes the result from our ICLB model. So this is the first result of the ICLB model. So here we can see that the standard deviation and mean of the alternative specific constant are all significant, indicating that the heterogeneity exists in baseline preferences for these mode alternatives. The shared error component is also significant and positive, indicating that shared shared heterogeneity exists for public transit and on-demand micro transit. And travel cost, the mean travel cost is also negative and significant. The travel time, wait time, walking time all reduces the utility of the relevant alternatives, although the cleaning frequency and ADA accessibility increases the utility or attractiveness of the alternatives. So healthcare trip, the dummy variable for healthcare trip is negative and significant, indicating that caregivers are more likely to skip a mobility of care trip if the trip is related to social recreation rather than healthcare trip. And also we can see that the socioeconomic vulnerability also matters. The low-income caregivers are more likely to opt out from making the care-related trip, but the low-mid-income group are less likely to do so. The coefficient for our latent variable psychological well-being and negative and significant, indicating that psychological well-being, higher psychological well-being reduces the likelihood of opting out. The sociodemographic characteristic, age, and say cognitive or psychological disability is also significant. And the caregivers who are under 35 years old are less likely, are more likely to have higher psychological well-being, and caregivers who have psychological or cognitive disability are more likely to have reduced psychological well-being. So these are the key findings from our study. So we can see that the key mode-related attributes are significant as expected. Travel time, travel cost, waiting time statistically significantly influences mood choice for care-related travel, and additional factors such as walking time, frequency of cleaning, and ADA accessibility have statistically significant mood-specific impact. Caregivers who are 35 years of old or 35 years of age or older, and caregivers with psychological or cognitive disability are more likely to have lower psychological well-being. Caregivers with lower well-being, as well as caregivers who live in household earning under $15,000 annually, are more likely to forego care-related trip while social recreation trips are more likely to be skipped. Caregivers living in household earning $15,000 to $35,000 annually are less likely to forego mobility of care trips. So we divided our policy recommendation in two parts. The first part is related to reducing structural barrier to non-discretionary healthcare trips. So from our study, we have identified the priorities subgroups for interventions. The subgroups are caregivers aged 35 years and older, caregivers who have psychological or cognitive disabilities, caregivers who live in household earning less than $15,000 annually. And findings support that expanding subsidized car share services such as MyoCar in low-income, low-density communities is essential, especially given that 54% of households have only one or no private vehicle in their household. For healthcare trip, policies should reduce travel time by lowering transfer requirement on key routes and expanding on-demand scheduling flexibility around medical appointment windows. ADA compliance should be treated as an essential baseline requirement in subsidized microtransit and car share programs. And finally, cleanliness and communication of cleanliness is important for creating trust among customers. So microtransit services should strengthen and clearly communicate cleaning protocols and make routine cleaning visible to support mobility of care trips. And the second part of our policy recommendation is related to mitigating social isolation through flexible community-based mobility solution. So the first one I want to discuss is about targeted mobility vouchers. So mobility voucher program or subsidized shared ride credits for social recreation trips can reduce the likelihood of opting out for these type of trips. And prioritizing caregivers in household earning less than $15,000 annually are important because they are more likely to forego these type of trips. And second one is door-to-door accessible service. So providing door-to-door or near-door service is important for reducing walking burden. So improving accessible boarding infrastructure for caregivers and care recipients is important so that they can participate more easily in community and leisure activities. Also, investing in flexible transportation hubs co-located with parks, libraries, community centers, and social services is important. These hubs can connect caregivers to shared transportation for group activities, social events, etc. So here I have listed some of the limitations of our study. So we collected a small portion of our data through a targeted outreach through a partnering community-based organization, so which can introduce some sampling bias. Also, a large part of our data came from online data collection platform where participants were recruited through online data collection system, and some caregivers who lack sufficient internet access or technical knowledge may have been excluded. And our sample size is relatively small considering that we have estimated a very comprehensive advanced model. So these are some ideas for future research. So most importantly, future research can extend the analysis to high density urban areas to compare how caregiver mobility pattern and transportation barriers differ across geographic and population context. And future research can also combine stated preference data with revealed preference data such as travel diaries, GPS-based trip records to strengthen modal validity. Future research can also collect longitudinal data to better understand how caregivers' well-being evolves over time and how these changes influence trip making and trip skipping decisions. And future research can also examine additional latent constructs such as peer influence, social norms. Yeah, and more importantly, future research can collaborate with community organization and service providers to design, implement, and pilot test the context-specific mobility solutions that were identified through our research. Thank you everyone for listening, and I will be happy to answer if you have any question.
Great. Thank you very much for that excellent presentation. Really important work, and I especially appreciate your attention to the implications and the policy recommendations that come out of it.
Thank you.
We've actually used up your allotted time, so we're going to move on to the next presenter. If anybody has questions about this presentation, feel free to use the chat, and Mahbuba can respond in chat to you. Thank
Good.
you. All
Thank
right. So next up is, I believe Zamzam's presenting.
I don't think Zamzam is here yet, so we can go to
Oh.
the next presenter.
Okay, great. Well, that may mean we have a little more time, which is great. So we'll jump to the third presentation, and I believe Elisa from UC Irvine is presenting that.
All right, thank you so much. Let me get my slides up. It will be interesting to see these two presentations side by side because you'll notice a lot of similarities in the methodology. So let's get into it. Can you see my slides okay?
Yes,
Yep.
perfect.
Okay, wonderful. All right, so my name is Elisa Borowski. I'm an assistant professor at UC Irvine in Civil and Environmental Engineering, and I'm presenting this research on behalf of my graduate student researcher, Tahsin Tabassum, who couldn't be here today. But we did this study on co-designing a community-tailored bicycle lending library in Santa Ana, California. So to start with, what are some of the issues with our traditional commercial bike share system, such as Metro Bike, City Bike, Diffie Bike, that you might be familiar with? Most of these involve relatively higher costs, often requirements of having a credit card or a smartphone, and the rentals are usually for limited durations. And if you go over your amount of time, there might be penalty fees involved. So this works for a lot of people, but there are some people that it doesn't work for. So the vast majority of US adults do have a credit card and or a smartphone, but there are a lot of people also who don't. So we wanted to help design a community-based system for borrowing bikes that would work for everyone. So we looked at this, bicycle lending library concept. And this is sort of these are some of the lower tech versions of those bicycle lending libraries. So this is really community centered. These are places where you could check out a bike for a longer period of time, maybe even keep it for a month. It's often operated at very low or no costs for the loans. And this is often done through nonprofits or public institutions like a library, maybe. They often come with different types of equipment people might need, like a helmet or a lock. And they might also be bundled with some kind of community-centered educational program, like training in how to ride bicycles safely. So, and then we took a co-design approach, which is this collaborative technique where we as researchers at a university were working collaboratively with our community partners to jointly design this type of service. And so there was sharing in the decision-making power around what that would look like. Community members and partners were compensated for their time and expertise. This is a relationship that develops over time. So I had been, attending events by our community partner long before I approached them to conduct research together, and we will continue working together after the end of this particular funded project. And there's flexibility to adapt to evolving needs. So I'll point out a few areas throughout this presentation where we did pivot a little bit based on what the community needed. And it's a long-term commitment that will go on beyond this project. So as I mentioned, it's focused in Santa Ana, California. So this is a majority Latino Hispanic community in a very densely populated city here in Orange County. It's the same county that Irvine is located in. We worked with a small nonprofit organization called Santa Ana Active Streets. They provide bicycle and pedestrian safety, education, resources, and advocacy to community members in Santa Ana, and they help to ensure that resident voices are included in planning processes. And then they helped us connect with another partner, Latino Health Access, which is another nonprofit in Santa Ana that helps to improve health, promote equity, and drive sustainable community change for uninsured and underserved Latino families. And then also Santa Ana Active Streets, which is also known as SAS, has a youth club known as SASSY. And the partners that we were working with were really interested in getting the youth involved in the research. So this was one pivot. We weren't originally planning this as a youth-focused study, but based on their interest and enthusiasm, we wanted to bring the youth in. So we focused on ages 14 through 17, so kind of high school age. This is a group that probably doesn't have a credit card. They might not have personal vehicles. Another caveat is to rent an e-bike. The person signing to rent the e-bike has to be 18 years or older in California. If it's like a fancier, faster e-bike, class 3, you have to be 16 or older to ride it. Also, our community partners pointed out that the local repair shops in the area couldn't address electrical issues with e-bikes. And so for that reason, we focused our design on just conventional pedal bikes, which I think is maybe a little less popular in the research sphere, but it was what our community needed. So we took a two-part approach. So as I mentioned, we weren't originally planning to work with youth, and it was my first time doing an institutional review board process for youth-based research, so it took much longer than planned. So in the meantime, while that was under review, we also did a statewide survey using a stated preference choice experiment to see what kinds of design parameters were important to people when it comes to bike lending libraries. And then once our IRB was approved, we held our workshops in the spring and summer. And this was with both youth and one with adults. And they got to have an opportunity to help design the bikes, the library, and the surrounding paths for a bike lending library. So I'll start by talking about the survey, which we did first. So this is what the choice experiment looked like. We had 3 alternatives, which covered different rental periods, so daily, weekly, or monthly. And then we varied along parameters of cost, storage availability, the weight of the bike, whether it came with a lock and or helmet, and whether some version of training was required, and that might be in-person or online training. And then we varied those systematically over just 6 scenarios, which is a little on the low end, but that was also a recommendation from our community partner that we wanted to keep, we didn't want to fatigue the people taking the survey. So this was designed collaboratively also with our community partner. We had multiple iterations back and forth to make sure that what we were designing met the needs of the local Santa Ana community, although we were launching it statewide. So we used the online platform Prolific to get a convenient sample. We collected 300 responses. This version of the survey was only in English. We have since translated it into Spanish, but we haven't received very many responses in Spanish yet. This was also only for 18 years and older. We collected this in March through May. We had 77% of our respondents Latino to match that population distribution in Santa Ana. And then we also wanted to focus on lower income households. The median household income in Santa Ana was 94,000. So we set our limit to being under 90,000 for a household income. And then the scenario that we presented for all 6 of the different varieties was imagine that your usual mode of transportation is temporarily unavailable and you don't know when it will be available again. A nearby community bicycle lending library is offering the following alternatives. Which of these would you choose? And they had the option to opt out if they didn't like any of the 3. And then because this was such a community-based project, we included a latent variable to try to capture what we're calling community strength. I'm open to other suggestions for what to call this, but we use the following 5 Likert scale questions to kind of capture how involved were community members, community leaders, community organizations, nonprofits, to try to capture that sort of like energy or power that can emerge within a community when people are really engaged and involved. So we wanted to see if that kind of a community, being in that kind of a community, had an effect on wanting to use a community bike lending library. So similar to Mahbuba's presentation, we also did an integrated choice and latent variable model for our 3 alternatives and the opt-out option. We have here our community strength latent variable. So that was significant. People who felt that their community was stronger in those measurable ways were also more likely to use at least one of the 3 options presented to them for a bike lending library. Just a few other things that required training had a negative utility for using the bike lending library. People didn't want to be required to do that. The lock was very strongly preferred. Helmet was a positive utility, but not so much. And then as expected, males were more likely to opt into the bike lending library. Although this was designed for low-income households, and we were hoping, we did find a threshold under a certain amount where people were less likely to use the bike lending library, and that was 35,000. So those are just some of those findings. And so, yeah, in summary, some of the key design parameters that we found from this survey were keeping it lower cost, a lighter weight bike, having more storage, and including a lock. So now I'll transition into our workshops. So these were held in Santa Ana. So we had a 3-part youth workshop series with 28 youth ages 14 to 17 that was held in May. And then we had 1 adult workshop, so we could also get some adult perspective. That was with an entirely Spanish-speaking group, 8 participants only, a split from male and female. They were between the ages of 25 and 54, so we're still missing that older adult perspective. And then all of those participants identified as Hispanic or Latino. And all workshops had Spanish interpretation and food available for participants. So in the youth workshop, they had some drawing activities, some collage activities, and then also some Q&A. And so we would ask them to start thinking about what they want the bike and the paths to look like, and then also kind of abstractly what they felt like the library should represent to their community. And then in the adult workshop, we did these like 3-dimensional diagrams. And this was right after, if you followed on the news, there was a chemical leak at an aerospace facility in Garden Grove, which is just to the west of Santa Ana, and the winds blow towards Santa Ana. So there was a lot of concern at this time in the community around emergency preparedness. And I've done some work on resilience hubs in the past, so we thought we might bring that in a little bit to this workshop and think about not only what would they like to see for a bike library, but could there be features of that bike library that could also help in an emergency situation and build resilience within the community. So that was the shape that took. And so some of the things that people talked about during these workshops, so with the youth, kind of talked about some pros and cons of bike lending libraries. They recognize that even though as students they got free bus passes, that it isn't really sustainable for people who work to have to pay for the bus day after day. So, this was a more affordable option for people who didn't have a car. They talked about people who were unhoused and how they might benefit from this service. They mentioned that some people don't know how to ride a bike, and if they had a bike lending library where they could learn, they might not feel as ashamed of not knowing how to ride a bike. They also said as a downside, they felt like there's more responsibility actually with renting something than with owning something. If you own it and it breaks, you can fix it whenever you have the means to do so. But if you rent it and it breaks, you're liable for it. So they were very concerned about that liability component. And then with the adults, similarly, they talked about people might not have access to a car, or maybe importantly also gas money when gas prices are so high. Not everyone has a driver's license. They also talked about how people carry a lot of things on their bikes in Santa Ana, so a cargo bike was something they were really advocating for. They, in their visions and their dioramas, they added a bike repair shop to the bike library, and then they also viewed the bike library as kind of this community space, a shared space where you could go with friends, family, meet people, and just create a sense of community and trust, they mentioned. And then they, from the adults' perspective, they saw this as a safe place where kids could learn to ride a bike, and they wanted some tables and shade and trees where they could sit and supervise the kids. And then for emergency preparedness, they liked the idea and presented the idea of having a community announcement board, and they were thinking about people who don't have a phone or any connection to emergency announcements. This could be like a bilingual, multilingual announcement board where people could get information if they don't have access to information. And then this quote I thought was really powerful, so I wanted to share in its entirety. Someone said, I'd like to express a sense of urgency for this change, especially regarding climate resiliency. I know the city has a plan, but the emergency started yesterday, and there are many changes that need to be implemented soon so residents can move around and be safe and healthy in the city. So some main takeaways. So we saw that this bike lending library could provide access to cargo bikes that might be really important for Santa Ana and an affordable way to get to work and school. It can be seen as a community space, a place for kids to safely learn how to ride bikes, and a space to build connection and community with trust within the community. During emergencies, it can be a space for multilingual information access. Some limitations were that we had fairly small sample sizes, both on the survey side and the workshop side. The surveys were conducted only in English so far, but we're working on that. And the survey samples skewed young, white, and primarily English speaking, which is likely because we use a prolific platform. And that's relative to, we compared that to Santa Ana. So even though it was 77 Latino, there was still a larger proportion of white individuals than for Santa Ana. And then it was not representative of the population of either the state of California or Santa Ana. So we can't generalize our findings across the population. Some future research directions, and we brainstorm these with our community partners, some things that they would really like to see. They're very passionate about this community-led educational cycling program. So they want to see maybe research on what is the effectiveness of this program and integrating it into city transportation plans, active transportation plans, and reducing participation barriers for historically marginalized populations. They're very interested in looking at the impact of gender inclusive and LGBTQ plus affirming safety training programs on improving perceived safety, confidence, and active transportation adoption. And they're also really interested in safe routes to parks. So maybe looking at how that kind of safe route infrastructure to parks integrated with bike library siting could help support the combined usage of the paths and the bikes and improve community benefit. So with that, I want to thank the University of California Institute of Transportation Studies for funding this project and through the Senate Bill 1. And I thank you for your time and attention, and I'm happy to answer any questions that you might have.
Great, thank you for that wonderful presentation. It's really an excellent example of community-based research, working with the community groups. So actually, I have a question related to that, which is, you're an engineer, so this is not a typical sort of research approach for engineers. So can you say a little bit about your experience doing this kind of work, and did you have any kind of training before launching into this, and what lessons learned for other researchers?
That's a great question. So my background is a little different. I have an undergraduate degree in anthropology, so I do have kind of a humanities interest, even though I also am in engineering. So I like to do interdisciplinary work. As a PhD student, I did receive some training I had one project that was community-based where we did focus groups. And so I got to see how that was done with like compensation and kind of the logistics behind that. So that was really informative and helpful. And then I started here as an assistant professor 3 years ago, and I've tried to use community engagement in all of my projects as much as I can. It's something I'm really passionate about. I was hired here through, I know it's unpopular now, but through an equity-focused and infrastructure equity position. And so I think participatory justice is really important, and bringing community members into the research process is just as important as the kind of equity measures from the outcomes of our project. So it's something that I'm staying committed to, and I learn every time. So lessons learned, it always takes longer than I think it's going to take. And so I think I'm still learning to sort of scale back what I'm promising through with each proposal that I write, to give myself a little bit more buffer. But it's a long-term commitment in all these cases. So I think community partners understand that, and also really they've actually expressed to me that like they're very grateful that I come to their events outside of the research, and that I'm committed to their communities.
Yeah, and not to put you on the spot, but in terms of thinking about the tenure process and
Such a
of
good question.
how this kind of research is viewed within your department. I hope you have good support for doing
That's
that.
a great, yeah. So I'm working on my mid-career evaluation right now. So it's due at the end of this month. So I'll find out in the upcoming year. But I think I feel supported. I feel supported through the Institute of Transportation Studies also. And I think it's just a slower type way of doing research. So I feel like I'm a little slower in my publications. And so hoping that that is understood and seen for the value that that the extra time is adding value to the work. But yeah, that's something I'm still navigating.
Great. Anybody else want to ask a question before we move on? I think we're going to end up with just 5 presentations, so we've got a little bit of breathing room. All right. Well, I think we'll keep going, and then hopefully at the end we have some time to discuss and reflect on all of this work that we're hearing about this morning.
That's great. Thank you.
Okay, thank you. So our next speaker is Dawon from Harvard. Dawon, are you there? I see your name. Dawon? Maybe he didn't expect to go quite this early. Give him another moment. Well, Lisa, I might ask you another question while we're waiting.
Please do.
I'm seeing lots of
Gone
blank
quiet for a
names
moment.
and muted symbols on my screen.
Yeah.
Um, you want to say a little bit about like the value of doing the qualitative in conjunction with the quantitative?
Yeah, definitely. So I think with a quantitative only approach, which is more common in engineering, we can see, this variable is maybe increasing the likelihood of this outcome or something of that sort, but we don't always know why. Well, usually at the end, I felt like even when I would do those types of studies at the end, there's always these questions of like, well, why are we seeing that? Or does this finding make sense? And so I found it really useful to have those community partnerships, even to bring findings back afterwards as we're developing the model and say, like, is this reflective of your experience? Do you think, does this make sense to you? And they always provide really things that I might not have been expecting, good insights. And so I think, yeah, it gives more meaning and value to our findings. It helps, validate or like kind of triangulate our findings a little bit. And I also was going to say, I think hearing the personal stories and how this is really impacting people, I think also helps to just convey the importance of the work that might get lost if you're just looking at the numbers. So for me, it really it makes it more powerful and meaningful. And I think for other people, it does too.
Yeah, I totally agree. All right, anybody else? Okay, call out to Dawon. Dawon, are you there? And if not, Noah, are you ready?
Yep, I'm ready.
Okay, last call, Dawon. We'll fit you in later. All right, thank you, Noah.
Yeah, no problem. All right,
Yeah.
let me pull it up here. Can you
Great.
let me share?
You'll introduce yourself. Yeah.
Yeah, let me just get my.
Okay. Great. And I think Zamzam, there was some email exchange. He's in the Netherlands and the timing was going to be an issue, so I'm not sure we're going to get him.
I just want to make sure it's not doing the present. That is okay. Hold on a minute.
Yeah.
Let me try this one more time. Okay.
I was an expert on this for a while, and now I'm out of practice.
I feel like they switch it up all the time on me.
We're seeing the notes version.
Okay, let me try this again. Okay, how's that?
Perfect.
Great.
Great.
Okay. Super. Yeah, thank you all. My name is Noah Goodall. I'm a researcher. The open book research is like my little nonprofit that I did when I want to do stuff that I can't do for my regular job. Normally I'm with a state DOT. But this project was a little off-brand for them, so I decided to do it at my own time. So I'm presenting it. This is about feasibility of using marriage and birth rates in transportation funding prioritization. The background motivation for this was the marriage and birth rates memo that USDOT put out in January 2025, right after the Trump administration came in. They put this memo out that had a lot of rules for how they might prioritize transportation funding going forward. And one of the big things in there was section F3, and it said would prioritize funding for jurisdictions with, quote, marriage and birth rates higher than the national average, which got a lot of attention when it came out because we'd never seen that before. It was kind of new. And everyone thought, what was that? Why would they do that? How would that affect the states? Because there's a lot of money at stake. USDOT awards about $100 billion annually to the states and local jurisdictions. And that's not nothing. That's about 20% of state and local transportation budgets. So it's a significant amount. There were a lot of factors in this. This is just one, but should this be a major factor, this could have pretty profound impacts on who gets transportation money and who doesn't. So I'm not clear on the current status of this. I haven't heard them mention this since. There's been almost no reporting on it. I don't know where it is, but assuming this is working or assuming this does work at some point, kind of what are they trying to measure? And do we have the data to support those measurements? That's the question I'm asking. To give you some background, first of all, the place most people go first for this kind of data is the American Community Survey. If you're not familiar, the U.S. Census Bureau runs a paper survey. Essentially, they send it to 3.5 million households a year. It's about 1 out of 40 households receive this. Completion rate's very high, about 95%. But it's not a lot of people. And when you look at a census tract, these are about 4,000 residents, give or take. You're only surveying about 2% of them, so maybe 80 people are filling out this survey. So it doesn't have a lot of statistical power. So at the census tract level, they typically do these 5-year rolling averages. And because it's a survey, you're only getting a sample. It's not the pure data, so there's a margin of error. And a margin of error can be pretty substantial, especially on rare events like births and marriages. A margin of error are generally reported at the 90th percentile, but you can, finesse that to the 95th, that they provide guidance for how to do that. So that's kind of the base data most people use when they're trying to calculate these things. So this has been looked at least 3 times in the literature that I've seen. Pretty brief looks because we're not sure where it's going. But the first one is Kaplan in 2025 looked at state and county level data. Again, they used the ACS data. They found birth rates increase with income, decrease with education. Marriage rates increase with income, percentage of white population, percentage of Hispanic population, and decrease with poverty and the percentage of Black population. In general, rural was going to get more money than urban areas, they thought. The Urban Institute looked at the tract level, again with the ACS data. They thought it would benefit high income and white residents. And then Baraha et al. 2025, again, also looked at tract level nationally. They thought it shift funding towards white Trump voting areas away from Black, Latino, and lower resource populations. So not really clear what's going on, but the 3 studies that were out there all use the American Community Survey data as if it were like factual data with no margin of error calculations. But I think the margin of error is actually really significant here. And I'll show kind of what I'm thinking here with that. So first, we need to look at how you define marriage rate because you think it's pretty straightforward. There's actually two popular ways of defining it. USDOT didn't say, and so we have to kind of guess. One is marriage prevalence. This would be the number of married persons divided by the adult population. Some places do the adult unmarried population as the denominator. But that's like, what are the odds that you are married? And what are the odds that someone you pull at random is married? So you would get that data from the American Community Surveys at the county and census tract levels. Then you have marriage incidence, which is the number of marriages that are occurring divided by the unmarried adult population. And so this is a different metric. I don't think anyone's more popular than the other one, but normally when people say marriage rate, they are generally referring to marriage incidence, the number of marriage events. So that's kind of one I thought they were going to use, but that one's actually really hard to find. The reason is the official marriage records are generally kept by the by the counties, and then consolidated by the states. And they're kept based on the county where the marriage occurred. They don't always record where the participants reside, and they often don't store that data or they don't make it publicly available. And if you wanted to the American Community Surveys does ask, did you get married in the last year? But they only report that out for the 8 largest counties in the U.S., so that's not enough coverage there. So the ACS is not really helpful. So for marriage incidents, you have to need the raw data. And the problem is when you record marriage by where it occurred, you get these really weird numbers like here on the table on the right. These are states with the highest marriage incidence rates. And you might recognize some of them. If you don't, Sevier County, Tennessee is Pigeon Forge. It's where Dollywood is, huge destination wedding place. We see Clark County, Nevada, that's Las Vegas, Maui, Hawaii, big destination weddings. Daggett County, Utah just has a very, very small population. They seem to have one wedding venue. And so they're having a lot of marriages per resident just because they have low residents. So that data is not helpful. So marriage instance is really hard. And I just wanted to keep going on that, how hard it is to get marriage data. Bowling Green State University maintains a database of this, and they went and tried to pull it from every state and just how hard it was to track down official marriage records. Here's every state. I actually went through and tried to redo their work and just to see what's the most recent year you can get. And you can see, I mean, some states haven't reported out since 2016. Some states never report out. The little cross in the notes section says that when Bowling Green went through, they actually had to call and physically talk to someone to get that data. And only 6 states were confirmed to have county residence availability. So long story short, marriage incidence is not really helpful. You can't really do that with our existing data. You have to use marriage prevalence. So you have to use the ACS data when you're doing marriage rate. Now let's look at birth rates. So the birth rate is, there's 2 ways to define that as well. There's birth rate and there's fertility rate. Birth rate is the births per 1,000 total population. Fertility rate is births per 1,000 women of birthing age. Places use both. So I wasn't sure what they use, but it's more or less the same data set. You would pull the populations from the ACS, from the census data. And at the if you were looking for births at the county level, those are pretty well maintained by the Census Bureau's population estimates program. So they have actually raw data. There's no margin of error there on the live births counts at the county level. But if you want to go census tract, you're back to going to the American Community Survey where they ask people, did you have a child in the last year? And on the right here is kind of a summary of the different ways we can measure birth and fertility, marriage incidence, marriage prevalence, and how you might do that. And as I said before, marriage incidence, we just don't have the data to support that. So we have to go with marriage prevalence. Okay, so that's high level stuff. I do want to pause before I dive into the results here. First is why am I looking at census tract instead of county? Because we have so much better data at the county level. Why don't I just work on that? Well, these are decisions to fund transportation projects. A lot of transportation projects do not serve an entire county. Like a bus line might only serve a part of that county. And census tracts are much more consistent in size than, say, a county. Right? There's 3,000 counties in the U.S. The 10 largest counties have a combined 41.7 million residents. That's 12% of the population in just those tiny 10 largest counties. And so you really need to break those up a little bit. And on the right here, I have a map of Los Angeles County and all the census tracts you can see drawn in. This is just part of LA County, maybe showing half of it. And so it's very, very broken up. And so the census tract level, I think, is a much more accurate way of doing this. You have a more consistent resident size. All the geographic areas very varied, but you can do more precise analysis for potential projects. All right, so into the results. First, I'm going to look at the county level in case they're going that way. And so what I did here is I looked at all the counties, and then I looked at different ways you can measure this. I looked at the 90th percentile confidence interval using birth rate and the marriage prevalence we talked about. 90th percentile confidence interval for fertility rate and that marriage rate we calculated. And then the same, but for the 95th percentile. So we have slightly larger error bars here. 90th is kind of what census uses, but 95th is what most science uses. So I try to include both. And then we have 3 categories here. We have funded, which means both those things were above average. So we know they're both above average. Then you have maybe, where at least one is in the maybe category. Sorry, maybe means one is above average, but the other category is either not above average nor not below average. So it's in that middle frame there. And then not funded means at least one of those, birth or marriage, was statistically significantly below average. So it's definitely getting funded. It might get funded. You have an argument either way, right? Because one of those factors is either above average or not below average, is within that margin of error. And then not funded where at least one was below average. So in the counties, you see what's interesting here is about 10 to 20% of counties can argue that they should get funds, or you could argue they should not get funds. You can make both those arguments there, just because of the statistical error. Now, counties are weird because the populations are all over the place. So if you look at population, it's a smaller percentage. It's between 6 and 8% of the U.S. population is in that kind of maybe range when you look at it at the county level. But as I argued, I don't think the county level is the right way to do this. I think census tract is more appropriate, and the numbers look really different at census tract. So on the census tract level, you have a huge percentage of tracts are in this maybe range because they're so much smaller and the margin of error is so much larger. That so many of these are not statistically significant. So you have 46% to 53% of the tracts and about the same percentages for the population because census tracts have roughly the same population as each other. So we're seeing just, almost half of the U.S. when looking at the census tract level could argue, hey, we should get transportation funding, even though they don't have a super strong claim to it with statistical significance. So that makes it really, really hard for USD to kind of make those funding decisions just because the data is not there. Looking at this a little further, what other things are we finding with this? I mentioned earlier in the other past research, there were some racial components to this, and there are. Marriage rate is strongly correlated with race and strongly correlated with income. The race part is a little more problematic because it might make this vulnerable to legal challenges. Just to give you an example of how severe we're talking about, if you looked at census tracts with higher than average Black population, they have a 24% chance of getting that marriage funding, of being above average. Whereas tracts with lower than average Black population have a 62% chance of getting that funding. So the disparate impact clause of Title VI would seem to be a pretty strong argument here that this is not this policy is having a very unfair impact on different populations. And that would have been a really good argument until June, because the USDOT removed the disparate impact language from Title VI in the U.S. Code, which went into effect in June 2026. So that argument is actually not in the U.S. Code anymore, so you couldn't use that argument. There's probably some other ways, but that particular argument is not the way to go with this. I think if this were challenged in court, I think the statistical argument would be a bit stronger, which is a little bit why I was kind of I wrote the research in this way. Now, are there other data sources? Yeah, probably. Marriage rates and birth rates are recorded in tax returns. It's not quite as clean because you write down, are you married, filing jointly, married, filed separately. So people are reporting that. That data is much more comprehensive. I would hope it's more accurate. I'm not sure. Births are also there as you're claiming dependents. That's a little fuzzier because dependent might not be a child, but that's another source for how to get this type of data at the IRS. The trick is getting it out of the IRS. The IRS does not share a lot of data. In the code, they have specific carve-outs for sharing raw data with other agencies. They can share it with Social Security, law enforcement, state agencies responsible for tax administration. Aggregated data is a little different. There's something in the U.S. Code, 266103 J2, I think. It's the part they can share with the Department of Commerce, which would include the Census Bureau. And the quote is for the structuring of censuses and that part's blocked on my screen. Economic accounts and this is the big part, conducting related statistical activities authorized by law. So technically they could give the data to the Census Bureau, who could then package it for USDOT to get it that way. I'm not sure how that would work. I'm not a lawyer. I don't know if that's legal or not, but that does seem to be a way that this could happen. This is an area of research for me of how they would actually get to that data. Because if they start making decisions based on this, they would need to justify kind of how they came up with that data. Is it statistically solid? They need to show how they got it. So that would be relevant there. In conclusion, at the county level, based on the data we have publicly available, 10 to 21% of counties are neither above nor below average at a statistically significant level. At the census tract level, it's 46 to 53% are in that kind of maybe zone. And I think the tract level is most relevant for urban projects, but cannot be reliably categorized as above or below average. And in short, we just need more guidance from USDOT about how this is going to be used, how they calculate rates, how they expect states and locals to calculate their rates, from what data sources, and how to handle the uncertainty. And that's all I have. Thank you.
Great, thank you very much. I'm told that we still have 3 speakers to come. Everybody's shown up, so we don't have a lot of time for questions, but just a very interesting exercise. A good example of how the devil is in the details, and maybe the details will save us from this horrible policy. I haven't heard anything about it recently either. Hopefully it's
Yeah.
just it was a statement that everybody's going to move beyond.
Mhm.
All right, so questions in the chat, if you have questions, and we are going to move on to Dawon's got his internet back, so we'll do Dawon next. And then Zamzam's here, so we'll do Zamzam after that, and then Tanjeeb, and the final slot as scheduled. Okay. Dawon.
Sorry, can you hear me? My
Yeah.
internet was a bit unstable. Sorry, sorry for the inconvenience. I'll share my
We have all experienced it, I'm sure.
Thank you for understanding.
If we had more time, Noah, I'd be interested in hearing about your nonprofit and that balance between doing sort of your advocacy work versus working for a DOT. Very interesting.
It's purely a tax shelter, I can tell you that much.
Yeah. All right, Dawon.
So I'll start my presentation. Hello, everyone. I'm Dawon, doctor candidate at Harvard University who's working with Professor Carol Vergaris. And today I'm going to present a chapter of my dissertation, Modeling Inclusion of Children and Caregivers' Daily Troubles. So when we talk about daily mobility, we often focus on commuting to and from work. But large share of everyday movement is actually about care, dropping children off, combining errands, and managing logistics of daily lives. These trips are very frequent, essential, and yet often invisible in transportation planning quite often. And this study attempts to make that relatively invisible mobility more visible. So what do we mean by caregiving travel? Caregiving trips refer to travel made primarily to provide care or assistance to others, most often within the household or family network. In my study, with a particular focus on travel choices involving children, I operationally define caregiving travel more specifically. In my study, it includes not only trips where an adult travels specifically to transport a child, such as journey to school, daycare, or leisure activities, but also trips where children accompany an adult as a part of the caregiver's own daily activities, including commuting, shopping, or personal errands. Daily travel involving children, whether to school, errands, or leisure, is a regular part of family life, yet it's rarely the focus of transportation planning. While prior research has primarily examined school trips, caregiving-related travel encompasses a broader mobility of care that includes escorting children to non-school destinations, combining errands with childcare, and adapting travel patterns to meet multiple household needs at once. It's also highly gendered. Women consistently take more of these trips, leading to shorter, more fragmented travel patterns and frequent trip training. What's missing from previous research is a systematic look at when and how children are included across entire tours, the full sequence of daily travel starting and ending at home. So this is my research question. Building on this gap, my study aims to model the inclusion of children and caregivers tours and understand how individual household and travel statistics influence these inclusions. Under what circumstances do caregivers travel with their children? Not only asking if children are present, but what affects their presence, depending on who the caregiver is, the household setup and the nature of the trip, and how these relationships vary across specific tour purposes. So before diving into the study, I'd like to briefly clarify that what I mean here by a tour, since this is a unit of analysis used in this research. A tour refers to a closed sequence of trips that begins and ends at the same anchor location, typically the home, and may include multiple stops and trip purposes along the way. This study draws on two one-day travel diary surveys. The first one, Danish National Travel Survey, and the other one is 2017 US NHTS National Household Travel Survey. Both recorded every trip of a respondent makes on their travel diary day, purpose, mode, duration, and who travels with them, and household and individual characteristics. So I pulled 15 years of TU data for Denmark because their annual sample is too small, restricting to household with young children shrinks it further. So the Danish data was only accessible on the site. So I spent a few months last year at the TU Denmark campus to work with it. But here NHTS US data is a single wave for 2017, which is the most recent public cycle and already large enough in their own way. Both samples use same restrictions. Household with at least one child aged from 0 to 9, young children. Under 10 is age range where children still needs an adult supervision to travel. So this is where caregiving travel is more intense, relatively. And respondents are aged from 23 to 69, covering both younger and older caregivers of working age. These tours are closed home-based tours of 12 hours or less, and meaning that tour starts and ends at home, like a daily travel. This unit of analysis I defined a couple of slides ago, and 12 hours covers the majority of them. And these restrictions I used for US and Denmark also. So in Danish sample, there are about 27,300 tours. Tours into 3 even groups. About 20% of them have children on their every trip. Another 29% have children on some trips of a tour, but not all. And school, like something like school drop-off with errands, and just over half, 51%, has no children involved in adults tour at all. And a few things that we can see here is gender is fairly balanced. About 90% of respondents are employed, and car accounts for 2/3 of tours, lower than you might expect for Denmark. But walking, cycling, and transit still make up a great share. Most of the tours are simple, not multi-trips, single destination trips. About 30% involve trip chaining, multiple stops away. And now it's about US sample. We have a slightly larger sample of 44,000 tours. And this is what two countries start to diverge. About 14% of tours, only 14% of tours have children on every trip. 6% of trip tours have children on some trips. And 81%, the large majority, has no children at all. And there is a very large gap. And in this sample, about 58% of respondents are women, 42% men, and roughly three-quarters are employed. So there are a bit bigger share of unemployment. And cars account for over 90% of tours, obviously, which is obvious. And tour complexity looks similar across two countries. So, US has like about a third of US tours involve trip chaining, close to Danish ones. So these were the descriptive findings of my samples. So using this data, I'm trying to estimate relative utilities of two countries. Some trips include children, or all trips include children relative to a reference category, in which no trips include children. The unit of analysis is a tour, with multiple tour potentially observed for the same household. Because the tours made by same household are likely to correlate it, so I used a mixed logic to model to account for unobserved household level effects and potential error correlation across the tours. These three categories here in diagram together form the choice set. Coefficients from the model are interpreted as the effect of each explanatory variable on relative utility of an outcome compared to a reference category of tours with no children. And these are the tables, but it's too long, so I'm going to skip to the comparison part for efficiency. So here are my findings for my models. So here's a comparison side by side. One has first, the US analysis is a single year 2017, while Denmark pulls 15 years of data. Difference in survey design, sorry. I couldn't choose it because of the sample size, but still it doesn't undermine the comparison, since I'm looking at structural relationships, not trends over time. They have clearest difference in gender between US and Denmark. In Denmark, being women raised the odds of full accompaniment, like fully accompanying their children on tours, but even after controlling for employment and household structure. But in the US, gender alone drops out entirely. It only matters to who you are on the top of being women, a single parent, or somebody employed. That's not what I'm expected a bit of a Korean, but I interpreted this as Denmark has strong family policy, subsidized childcare throughout the country, and shared parental leave. So I expected there could be a smaller gender gap, but here United States has more related to those the circumstances of women are in, like they're employed or they're a single parent. And my read on this research is that institutions can remove barriers of caregiving. Danish mothers don't have to choose between working and having a job. So the way many single mothers in the United States chose to do. So without changing who does day-to-day caregiving. So supportive policy would narrow this gap. And here income tells a quite different story. It matters a lot in the United States. Lower income households are far more likely to travel with their children on the way, largely because they have fewer options to outsource childcare out of their household. So in Denmark, income barely matters at all once other factors are controlled over. And there are some consistencies in both countries. Young children raised out of being accompanied to adults' tour, and older children lowers it. And trip training is what drives the parental accompaniment everywhere. So these feel like more universal, less context dependent users. And final part of my study, I turned simulation analysis. These two charts show predicted probabilities of flight tour duration using each country's observed samples. So every tour keeps its eye on real-world characteristics, mode, income, employment. And I just plot the predicted outcome against duration. Top is US and the bottom one is for Denmark. Start with US adults. Only tours dominate the whole week throughout, the green one. Full and partial accompaniment together never really break out a thin band at the bottom, the yellow and the blue one. And that band fades out almost entirely past over 500 to 600 minutes. So in the US, duration barely matters. Caregiving trouble is overwhelmingly adult only, no matter how long the tour is. But Denmark shows a bit of a different pattern. Adult only tour starts much lower, occupying the green one. They have only about half the probability space for short tours, only becoming a clear majority past long tours over 600 minutes. For full accompaniment type, the blue one is actually stronger. They have stronger pattern, and for shorter tours under 400 minutes before it declines sharply nearly and disappears by 500 minutes. And partial accompaniment stays a fairly steady minor shares throughout. So here the contrast between two charts is the real point. In the US, whether the tour is shorter or long barely changes the picture. So it's adult only either way. But in Denmark, the duration matters much more. Shorter tours are meaningfully more likely to include children, and that likely as a tour gets longer. And to wrap up, the findings confirm that persistent gender caregiving roles, women continue to take on a greater share of child-related trouble. There's like a echoing pattern found in earlier studies. And from policy perspectives, this is a point that points that need transportation systems that support multi-stop and flexible trips. For example, daycare drop-offs, and that combines with errands or work communities. And promoting family-friendly mobility means thinking beyond commuting, ensuring safe walking routes, safe bicycling infrastructure, and better coordination between childcare and transportation planning. Thank you. Overall, my goal is to better understand how caregiving responsibilities shape everyday mobility and how transportation planning can. Thank you. This is the end of my presentation.
Great. Thank you very much. We're going to have to move right on to Zamzam. And while he's setting up, I'll just note, yeah, very interesting gender differences and the differences in the gender differences between the US and Denmark. Zamzam, can we get your presentation?
Hi, thank you, Susan. Great. Thank you, Susan, and thank you everyone for being in this session. My name is Zamzam. I'm doing my PhD in transport and planning at the Delft University of Technology in the Netherlands. And this presentation, I'm going to talk about, can traffic congestion be managed without compromising social equity? Traffic congestion remains a persistent challenge in many urban cities around the world. And there are many ways to manage that, including transportation policies and travel demand management policies. One of those policies is, just an example, is congestion pricing. But of course, because we're talking about a social technical system, which is a transportation system that includes people who are using the system, those types of policies does not only, the efficiency does not only depend on how well managed or well designed the policy is, but it also depends on the travel behavior of the people who are using the system. So even after those policies are introduced in the system, some people would still afford to use the system. They can't pay to use the road, and they can still use their own cars, and that would create more congestion. On the other hand, there are some other groups in society that cannot really afford to pay for the service anymore because it's becoming more expensive. And then that would create some social externalities leading to some social exclusion problem. And so we need to think about alternatives to manage this externality. And that from where comes the idea of integrated policies. So in this research, I'm trying to look into different type of policies with different effects, including push and pull effects, and see whether those integrated policies on the road can balance the social equity impact on some social groups, but also maintaining the traffic performance of the system. So the two main research questions here are, the first one is, does the integration affect traffic congestion differently? Because we also don't want to compromise the traffic performance of the road. And then the second question is, can the integration of push-pull TDM policies, travel demand management policies, reduce social equity externalities? To do that, just let me talk a little bit about the scope. I've been testing 3 travel demand management policies, including 2 of them with push effects and 1 of them with pull effect. So whether people would own a car or not, one of the policies that affect their decision to own a car is parking management, talking about the supply of parking, and then whether they own a car or not. If they own a car, then whether they would use it or not. And then there are 2 policies that would affect people's decision to use their cars, including parking management in terms of paid parking and congestion pricing. If they are not owning a car, then we need to look for alternative modes of transport. And here comes the other policy, which is shared mobility services, or the existence of shared mobility services. So I'm testing parking management and congestion pricing as push policies, and then shared mobility services, the existence of those services as pull policies. For the social equity variables, I've used variables that have been collected from the Netherlands, from surveys in the people of the south of Holland. And those variables include these 4 highlighted variables: the high cost of fares, the car ownership, whether they have a car or not, low income, and also low skills. And then those kind of variables would create either transport disadvantage or social disadvantage, which would create transport poverty, and then that would lead to social exclusion. So these are the 4 variables used or tested in this research. Now, to do that, because I've been talking about a very complex system here, which is it's a transportation system, it's a social technical system. There are 2 objectives: traffic performance and social equity, and I'm also testing 3 policies. So one of the best methods to do that is system dynamics. And so what I'm doing here is I'm using a qualitative system dynamics in terms of causal loop diagrams. So causal loop diagrams are diagrams that would show different variables with different causalities between those variables. Like it shows the fundamental relationship between variables and how each variable is affecting the other variable, and whether there are some feedback loops in the system to understand the overall performance of the system. These are the type of variables included in the causal loop diagrams, including policy instruments, traffic performance variables, spatial variables, and travel behavior and socio-demographic variables. To start developing the causal loop diagrams, of course, we will need to collect data from literature reviews. So what I did is I collected data of the variables in terms of those, so the scope of those fields. I've reviewed literature review papers for the scope of the Netherlands, as well as some Western European countries, to break down the variables and find out the fundamental cause-effect relationships between those variables based on theoretical and empirical evidence from research, and then to find out the causal loop diagrams, either reinforcing or balancing, because we'll have fundamental cause-effect relationships, then we'll have some feedback loops to do that, and to not miss any of those feedback loops, I've used a Python-based relationship mapping library to do that. And then the first draft of causal loop diagrams are built. And because this is a qualitative research, we need to validate those causal loop diagrams. And to do that, I used a combined Delphi method with the participatory system dynamics. So for the Delphi method, there are 3 rounds to validate the causal loop diagrams. The first round is an internal panel with my research team. We do 2 brainstorming sessions to improve and add some other hypothesized fundamental cause-effect relationships between variables. And then after that, the second round was an expert semi-structured interview. I interviewed an expert in transport and social equity field with over 46 years of experience to look into those causal loop diagrams and try to identify some fundamental relationships, add some variables or remove some variables, and so on. And then, of course, those are further improved. And then the last round of validation is an expert survey. For this round, I created a survey for 12 experts, not only from the Netherlands, but also from other Western European countries, including the UK, Germany, Belgium. Those experts are mostly in the field of transportation and planning, policies, social equity, and system dynamics. For the survey, to make it more systematic and to reduce the cognitive burden for the people to review those causal loop diagrams, I've used DEMATEL-based survey design, which stands for Decision-Making Trial and Evaluation Laboratory Method. So what DEMATEL basically do is to collect data in terms of quantitative data and then transfer that quantitative data into qualitative findings. And I'll talk about that more in the next slide. After that, from the DEMATEL survey, I could generate network relationship maps, NRMs, and then those NRMs can be compared to the causal loop diagrams to finally get the final validated causal loop diagrams. So for the DEMATEL, as I've mentioned, there were 12 experts. And instead of showing those causal loop diagrams to those experts, I showed them every relationship between A and B, every variable, and then they need to give a score to those relationships. And in DEMATEL, you'll ask both ways, like from A to B, what is the relationship, whether there's no influence from variable A to B, or there's no causality, or there is a very high influence from variable A to B, and then vice versa from B to A, and so on. After some calculations, you can generate those NRMs, which stands for Network Relationship Map. Those are basically showing different variables. The variable in red is the main variable, and what are the causalities this variable is causing to other variables. Anything above the x-axis is causes, and anything below the x-axis is effects, which means the arrow moves from cause to effect. And then I could validate those causal loop diagrams using those NRMs. So to talk about some findings from this research, I've developed different causal loop diagrams. The first one is the system dynamic, the traffic dynamics, traffic congestion dynamics, to understand the overall system of traffic and how it impacts different social groups in the society. or the users of the system. What I can find here is that there are some balancing loops, which means the effect of what one variable is balanced by another variable. And what you can see here, all of those balancing loops here, B1, B2, B3, and B4 are all balanced through social equity variables. These are social equity variables which are in bold between square brackets. And that means traffic congestion dynamics have stronger impact on lower income and disadvantaged population groups. Talking about other, so what I did is I have one causal loop diagram for the overall system, the traffic congestion system or traffic congestion dynamics. And then also for each two variables, pairwise policies, I have 3 causal loop diagrams. And then I have a bigger one for all the policies to test the impact of those push and pull TDM policies. So I'll talk about what happened when I integrated congestion pricing with parking management. Both of those policies, parking management and congestion pricing, affect the long-term and short-term of people's behavior to use their cars, because they increase the disutility of driving, which means it also leads to an increase in the shift to alternative modes. But the thing is, adding those two at the same time would accumulate the impact on disadvantaged populations through affordability as one variable in the social equity. So what I can say is in integrating two policies with push effect improve traffic performance, but it also accumulates the impact on disadvantaged population groups. This is the also I want to include some or explain some findings from the last causal loop diagram, which includes all the 3 policies. We have parking management in navy blue, and then congestion pricing in orange, and the existence of shared mobility in green. So as I've mentioned, parking management did not include any further feedback loops in the system, but it amplifies the impact on 2 variables, car ownership and affordability, which means when it is integrated with congestion pricing, it adds more burden on socially disadvantaged population groups. Also, I've mentioned that congestion pricing with parking management can shape travel behavior in the long term, because parking management can, first, congestion pricing can impact people's behavior in the shorter term, because that would affect my decision to use my car if I need to pay to use the road. On the other hand, parking management, especially the supply of parking, as shown by some research in the Netherlands, affects people's decision to buy car, and that means it's a longer term impact policy. Now, talking about the existence of shared mobility services in the system, it's a policy with pull effect, and it can reduce the social externalities by adding an alternative to mobilize from one place to another. It also manages policy resistance and public acceptability, because people can find another alternative to move more comfortably from one place to another. Also, I've mentioned in the first causal loop diagram that all of those feedback loops are balanced through social equity variables, and adding shared mobility services as a policy added another or a 4th factor that also created more balancing loops in the system, which is a positive effect of this policy. It's also important to note that shared mobility services can increase traffic congestion by increasing trip frequency and also the trip distance in the case of a very affordable service, and it's a very convenient, and also the availability of the service. It also can increase the traffic through induced demand when the people shift to use alternative modes, including shared mobility services. There's more empty space in the road, so people would tend to go back to use their private cars. That would create an induced demand in the system. So that means it's always important to add additional policies to the system, not only those pull policies, but also adding some restrictions to using cars so that we can create more balancing impact. That's all for my presentation. Thank you very much. The paper is currently under review, but you can find the preprint on the internet, so you can scan this barcode and find it if you're interested. Thank you.
Great. Thank you very much. A very impressive analysis with some important results. Okay, we're going to move on to our last presentation, which is going to be shared with Tanjeeb to start with, and then Rezwana.
Yeah, hi. So Tanjeeb and I will both be presenting our work today. So let me first share my screen. Can you see my full screen?
Yes, perfect.
Yeah, thank you. Hi, everyone. Thank you for joining us today. I'm Rezwana Rafiq. I will present our work today with my co-presenter, Tanjeeb Ahmed. We are both currently working as an assistant project scientist at UC Irvine. Our co-authors are Professor Hyland and Professor McNally from UCI. So today we'll be presenting our work on an important question in post-pandemic travel behavior, like how did post-pandemic access to telecommuting affect VMT? As we all know, the COVID-19 pandemic and its subsequent travel restrictions led to a major increase in working from home. A national survey from early 2020 showed that more than 1/3 of US workers shifted to remote work, which was nearly 6 times higher than the pre-pandemic level. Looking just immediately after the pandemic, the 2022 National Household Travel Survey found that 62% of adult workers worked on site, 19% did hybrid, and about 20% worked entirely from home. Now turning to the most recent 2025 data, the graph on the left shows the distribution from one of our project surveys conducted in California by Ipsos in 2025, while the graph on the right-hand side shows comparable results for full-time workers from a 2025 national online survey. So both sources show a consistent pattern, that is about 60% of workers are fully on site and about 40% work from home to some degree. So after looking at the telecommuting rates over time in the context of US, now I would like to briefly highlight a few recent studies that examine similar questions to help frame and contrast our study. So Zhang and others reported that 1% decrease in the share of on-site workers results in roughly 1% reduction in VMT. Using Puget Sound Regional Council data, Wang and Voss showed that increased access to remote work has produced a meaningful reduction in average daily VMT among workers. Rafiq and others found that an additional telecommuting day per week can reduce per capita VMT by 5%. So therefore, after looking into those contexts and data, we tried to focus on a more policy relevant question, like how did workers who didn't have telecommuting access before the pandemic, but gained it afterward after the pandemic, experience changes in VMT compared to the counterfactual scenario in which they didn't gain such access. So a counterfactual scenario is a hypothetical what-if situation used to assess what would have happened in the absence of a specific event, policy, or condition. So in our case, the specific policy is gaining telecommuting access. To estimate this counterfactual scenario, we used a difference in difference framework. So the treated individuals are those who gain telecommuting access, that means who had telecommuting option after the pandemic. In other words, we can say that gaining telecommuting access is the treatment here. Okay, so that difference in difference, what we can call DID in short, this framework allows us to estimate how the VMT would have changed if they had not gained telecommuting access. But applying DID represents several methodological challenges. First, it requires well-matched treatment and control cohorts to ensure that differences in VMT changes can be attributed to gaining telecommuting access. And second, this method ideally relies on longitudinal panel data to track the same workers over time. But longitudinal activity travel panel data are very limited in the context of US. To address this limitation, we constructed a shadow panel using repeated cross-sectional data from the pre- and post-pandemic periods like 2019 and 2023 from the Puget Sound Regional Council data. So we used propensity score matching technique to construct this shadow panel by matching workers who didn't have telecommuting access in 2019 with workers who gained access by 2023 based on their socio-demographic characteristics. So this group represents our treatment group, that is workers who didn't have telecommuting access before the pandemic, but gained such option to telecommute after the pandemic. And our control group represents workers who didn't have the option to telecommuting either before or after the pandemic. We also conducted additional matching within each period to ensure that the treatment and control groups are comparable, with telecommuting access status being the primary differentiator. We faced a further challenge that was the lack of a direct measure of telecommuting access in the pre-pandemic 2019 PSRC dataset, like the Puget Sound Regional Council data. So they didn't have any direct variable or direct question where they asked the workers whether they have the option of working from home or not before the pandemic. They didn't have that data. So we further addressed this challenge by estimating. What we did is that we estimated the pre-pandemic telecommuting access using a binary logistic regression trained on pre-pandemic NHTS data, that means 2017 National Household Travel Survey data for the Washington region. So we then applied this model to the 2019 PSRC respondents to predict their likelihood of having telecommuting access. I will explain this process in more detail later in the presentation. So now let me talk about the data that we used in this study. For this study, we used 3 data sets from 3 household travel surveys considering the Puget Sound region. So this region is located in the western part of Washington state and consists of 4 counties. The 3 data sets that I talked about are 2017 NHTS, the 2019 and 2023 Puget Sound Regional Council household travel surveys. So here samples are limited to only adult workers traveling on weekdays. The processed and filtered datasets contained about 1,000 workers from the 2019 PSRC and 2,800 workers from the 2023 PSRC dataset. Now let's move into the 3-stage modeling approach that we use to address our research question. As discussed in the previous slide, our analysis consists of 3 main stages. In the first stage, we used a binary logic regression model with the 2017 NHTS data to estimate the telecommuting access for workers in the 2019 PSRC data. And in the second stage, we use the propensity score matching to create balanced treatment and control cohorts across the 2 time periods. And as I said, to create the shadow panel. And finally, in the third stage, we applied a difference in difference model to estimate the counterfactual VMT. Let me discuss the first stage of our modeling approach. We first developed a binary logic regression using 2017 NHS data from the Washington region to estimate workers' likelihood of having telecommuting access. The model included key factors like household income, education, employment status, schedule flexibility, age, race, and ethnicity. And due to the data limitation, we couldn't use one of the important variables, that is occupation, in this model. We then applied this model, this binary logic model, to the 2019 PSRC worker sample to generate individual level probabilities of telecommuting access. The figure on the slide shows the distribution of predicted probability of having telecommuting access in 2019 PSRC sample. As you can see in the figure, the distribution shows a clear separation around the 0.25 probability threshold. So about 46% of workers had a predicted probability of 0.25 or less, which indicates that they were unlikely to have telecommuting access. And therefore, we use the 0.25 threshold to identify the workers unlikely to have telecommuting access in the pre-pandemic, which give us around 1,200 workers for the subsequent PSM analysis, like the propensity score matching analysis. So now my co-author Tanjeeb Ahmed will discuss the remaining methods and results. Thanks.
Thank you, Rezwana. Could you go to the next slide, please? So in stage 2, we apply the propensity score matching to construct comparable cohorts from the 2019 and 2023 repeated cross-sectional surveys. So this creates a pseudo-panel design in which the treatment and control groups are balanced on observed socio-demographic characteristics, making telecommuting access the primary difference between them. So the propensity score helps us replicate as closely as possible the conditions of a randomized experiment using observational data. So these scores are generated through a logistic regression to estimate each worker's propensity score, which is the predicted probability of telecommuting access based on observed socio-demographic characteristics. So we then use the one-to-one nearest neighbor matching with replacement to pair the workers with similar propensity scores. So the flow diagram at the bottom summarizes how we apply the propensity score matching, or PSM in short, to build the 4 matched groups at the end. So from the left, the first diagram shows 3 separate data sets that we begin with before we apply the PSM. It shows in 2019. It shows in 2023 the identified treatment and control groups, and for 2019 it shows the combined treatment and control group because they are still identified because of the lack of variable on telecommuting access. So after that, we apply the PSM, and the sequential process is illustrated in the middle diagram. So in PSM1, which you can see in the rightmost arrow, coming from the 2023 control to treatment group, we match the 2023 workers with telecommuting access to the 2023 workers without access, so which is the control group, creating a balanced 2023 treatment and 2023 control groups. In PSM2, which you can see the green arrow coming from 2019 combined treatment and control group to the control group in 2023. So in PSM2, we take that 2023 control group and match it back to the full 2019 sample, which identifies both the 2019 control group that looks socio-demographically like the 2023 workers who never had access. So this actually separates out the treatment from the control in 2019. So the control group is now identified and matched. So finally, in PSM3, the remaining unmatched 2019 workers are then matched to the 2023 treatment group. So this gives us a 2019 treatment group that matches to those who will later gain access in 2023. So after these 3 rounds of propensity score matching, we end up with 4 balanced groups, as you can see in the last diagram on the right. So in the process of balancing the groups, as I mentioned, we have also identified the treatment and control groups in the 2019 dataset. And each of these 4 matched dataset contains 726 workers, which we use in the subsequent DID analysis. Next slide, please. This slide shows the covariance balance results of the PSM model. So you can see each panel here displays the standardized mean differences for the covariates that we used for the PSM matching. So the before values before matching are in blue and the after is red for all of these three PSMs. And initially we see some values in blue differ by up to 0.3 standard deviation between treatment and control groups. But after matching, it all aligns within point or plus minus 0.1 standard deviation, indicating excellent covariant balance between them. Next slide, please. So once we have all the four balanced group, we apply stage 3, the difference in difference model, to estimate the causal effect of gaining telecommuting access on a daily VMT. So the outcome variable Y is the log transform daily VMT. We also include an indicator for time, comparing 2023 to 2019, and an indicator for the treatment group membership, and an interaction term between time and treatment. So the coefficients labeled here, alpha, beta, and gamma, captures respectively the baseline VMT for the control group, the baseline differences between treatment and control, and the common time trend affecting everyone. So the coefficient we care most here is the delta, the interaction between time and treatment, which is the DID estimator or the average treatment effect on the treated. So graphically, as you can see on the right, that is the vertical gap between the observed 2023 treatment and the dashed counterfactual line showing how their VMT would have evolved if they have never gained the telecommuting access. So because the groups were balanced on the observed variables and we control for the socioeconomic covariates, this DID setup lets us attribute that extra change in VMT to gaining telecommuting access under the standard parallel trends assumptions that we make for developing this DID model. Next slide, please. So this slide shows the main results from the DID model, and we summarized the results with the help of two charts. So the top chart shows the estimated effects for the DID, or the average treatment effect on the treated, or ATT in short, in blue. The effect of time in green, and the effect of treatment group in orange in the middle. So these results indicate that workers who gained telecommuting access between 2019 and 2023 drove about 15% less on average than their matched counterfactuals who never gained access. So that 15% reduction is the average treatment effect on the treated, or ADT. In other words, it is the additional drop in VMT for the treated group over and above the general post-pandemic trend and their higher pre-treatment baseline. And the bottom graph illustrates this by showing the treatment group's 2023 VMT falling below its counterfactual path. At the same time, there is a strong overall time effect. The VMT falls about by 26% between 2019 and 2023 for both treatment and control groups combined, reflecting a broader structural changes such as online shopping, mode shifts, and other post-pandemic adaptations. And interestingly, in 2019, before the pandemic, the treatment group actually had higher VMT, so driving roughly 19% more than the control group in 2019. So the 15% reduction we estimate here is actually being measured relative to a group that started out as heavier drivers initially. Next slide, please. So So I'd like to note three important limitations before I go to the concluding slide. The first is because the 2019 PSRC survey did not directly measure telecommuting access, we inferred pre-pandemic access using a logit model estimated from the 2017 NHS dataset. So this introduces a potential classification error, which since predicted access may not perfectly reflect each worker's actual telecommuting eligibility in 2019. Second, some potentially important explanatory variable were unavailable, including occupation, and other consistent residential and workplace location measures. So as a result, we could not fully account for those differences in job type, urban farm, and other location-related travel behavior. And finally, although matching creates strong balance and observed characteristics, unobserved time-varying factors and workers' own decision to seek telecommuting access may still influence the results. So therefore, the finding should be interpreted as a quasi-experimental estimate that relies on the standard parallel trend assumption rather than an evidence from a randomized experiment. Next slide, please. So before concluding, I'd like to discuss the major takeaways and policy implications. So the first takeaway is that expanding telecommuting access has a meaningful impact on individual travel. For workers who did not have access before the pandemic but gained it by 2023, the daily VMT is about 15% lower than it would have been if they remained in office, after controlling for the time trends and the baseline differences. So this makes telecommuting a credible demand management strategy, not just a short-term pandemic response. The second takeaway is that the VMT is strongly associated with socio-demographic characteristics. For example, households with at least one vehicle per licensed driver exhibited roughly 166% more VMT than households with fewer vehicles per driver. And medium-sized households and middle-aged workers also show substantially higher VMT than single-person or older households. So these patterns underscores that remote work policies will interact with vehicle availability, life cycle stage, and income in shaping travel outcomes. And finally, from a policy perspective, this results suggest that telecommuting should be explicitly incorporated into regional travel demand forecast and long-range plan scenarios. And the average treatment effect on the treated is particularly useful for policy evaluation because it captures the realized impact among workers who actually gain telecommuting access rather than hypothetical effect on a random assignment. And because that it represents a 15% reduction among workers who actually gain telecommuting access, it provides an evidence-based estimate that regional planners can use to evaluate VMT reduction strategies.
And we are out of time, so I'm going to thank you there for your very careful and creative approach to answering this important question that is surprisingly hard to answer, and I think points to the need to really think through our data collection to make sure we've got the variables we need. So please join me in thanking all of our speakers in this wonderful session. In the chat, there are links to the sessions that are starting right now, and there will be one in this room. So if you're interested in that one, please stay on. Otherwise, jump off and head to another one. Thank you.